Good evening, student. Today's topic is ectopic pregnancy. So, an ectopic pregnancy is the definition. First, we can know about the definition. And definition is an ectopic pregnancy is one in which the fertilized ovum is implanted and develops outside the normal endometrial cavity. It means that pregnancy developed, the ovum and sperm fertilized, but the fetus developed the uterine or other than the uterine part instead of normal location of implantation. So normal location of implantation is known as near to the fundus. So what is the site of implantation? It is called extrauterine and uterine. It is either outside of the uterine or uterine. So extrauterine, we first known about the extrauterine. So extrauterine is tubal, ovarian and abdominal. So it might be tubal, it might be ovarian, it might be abdominal. So tubal means fallopian tube, ampulla, isthmus, infundibulum, interstitium. These all four parts, it is the fallopian tube. So we all know that our fertilized occur in the fallopian tube ampulla side. So but if this growth of the fertilization is occurring in these four parts, then it's called ectopic pregnancy. Then we know about the ovary. Ovary means the ovary where the ovum growth and develop, that is ovarian. So if that fetus developed in the ovary, that is called ectopic pregnancy. Abdominal is primary and secondary. Primary, it is the in the abdomen. Secondary has two parts like intraperitoneal and extraperitoneal broad ligament. So intraperitoneal, it means the inside the peritoneum means abdomen, and extraperitoneal broad ligament in either side of the umbilical side. Extraperitoneal broad ligament. Then uterus. So we all know that our fetus growth developed in the uterus, but it's except the normal part of the uterus. If it is developed in cervical, angular, cornual or caesarean part, then it is called ectopic pregnancy. Then what is the cause? Exact cause is idiopathic. We don't know what is the cause of it, but risk factor. So many risk factors are there. We can discuss about it, like history of pelvic inflammatory disease. If the patient is having the history of pelvic inflammatory disease, that can be developed the ectopic pregnancy. And history of tubal ligation. Tubal ligation means the tubectomy. Then contraception failure. If the patient is taking the contraceptive pill, so if it is failure, if it is not work, okay, so then it can be developed the ectopic pregnancy. And previous history of ectopic pregnancy. Then intrauterine device. So intrauterine device like copper T. History of induced abortion. If the patient previous history of induced abortion if having, means that can be developed the ectopic pregnancy. These all are the risk factors. Next we can see the clinical features. So clinical features is acute, unruptured and subacute. Acute means it is not rupture. Okay, it is not very common. Okay. Unruptured and subacute, which is chronic and old. Symptoms which means that is patient is complaining. Subjective data, patient is complaining. So what all are the patient complain? Vaginal bleeding, amenorrhea, absence of menstrual period, abdominal pain, lower abdominal pain or mostly abdomen part pain, okay, vomiting and fainting attack. Then we can see about the signs. Signs is the objective data, what you observe as a nurse, you observe or the doctors observe. So objective data, it is can general look, foot to head to toe examination, pallor, features of shock. Then pelvic examination. You can see the vaginal mucosa which is bleached white and uterus slightly bulky, the bulky of the uterus. Then extreme tenderness, the patient lower segment is extremely tender and hemorrhage, patient is having hemorrhage. Next we can see the diagnosis, means what is the diagnostic evaluation and the examination you should done for this ectopic pregnancy. Then like blood examination, estimated beta human chorionic gonadotropic hormone test, sonography, ultrasonography, which is known as ultrasonography. Then sometimes we both this combination we can be done. Laparoscopy, definitely laparoscopy, which is help for the development of the fetus, which helps to know. Then serum progesterone, level will be less than 5 nanogram per ml. Okay. Then management, we can know about the management. So management, it is the medical and surgical management. So medical management, direct, either direct or systematic. So direct, it is laparoscopic USG guide. They are held on the laparoscopy surgery by help of USG guided. Then USG manipulating. So systemic, so medical termination and actinomycin, these both can be used. And surgical, it is conservative. First we know about the conservative. What is that? Expressing out from distal tube. Expressing out from distal. One surgery name is expressing out from the distal tube. Then next is the sulfingostomy. Which is the sulfingostomy. Then sulfingotomy. Then extricative, it is known as the sulfingectomy and segmental resection. Is the sulfingectomy and segmental resection. Sulfingectomy, removal of the fallopian tube. Fallopian tube we call the sulfinge. Then complication, what can be occurred? Trophoblastic disease. So today's topic is ectopic pregnancy, that is over. So if